Alive on the moon. Charo, it's on the pen alive. With your host David Knapp.
Thank you, Clap Track, and happy Thursday night. I'm your host, Dave Knapp, man on the Manjaro. That's why I'm here. You are on the pen. Wegovy, Saxenda, Victoza, Trulicity, Manjaro, Zepbound, Compound, that pen. That's what we talk about here each and every week. And on the pen, it's so great to be with you all. We've got a wonderful show lined up for you tonight. Dr. Harmon Toomer is here to discuss all things GLP-1, anti-obesity medications, all of the things. And we're so excited and delighted to have her here tonight. Of course, we've got our maintenance minute with Corey and our Reddit recap on tap from the birthday girl. Yes, that's right. It's Allie's birthday today at Fit Flavor Fun. Just got a year older, and we're so happy to have both of those ladies each and every week. Give them some love in the chat. And thank you. Thank you for being here. Thank you for being the best part of what we do here at On the Pen. We could not do this without you on the 104th episode tonight. 104th episode. So we're super glad to have you all here tonight. It's been a wild week in the Knapp household. So there hasn't been a lot of prep work that has gone into the show, to be honest with you. It's been a wild week. We have currently 3 out of 4 kids down with influenza A, including my wife. So why are you here, Dave? You might ask. I don't know. It's a good question. I probably shouldn't be, but we are because we're here, rain or shine, each and every week. And so forgive me for the lack of preparation tonight, but we do have a great show nonetheless. We pull it off because we do have such wonderful team that we rely on here, Corey and Allie, and actually the video that I'm going to play, and we're gonna jump right through because actually I'm having some technical difficulties tonight. On top of everything else, our internet was really slogging around, and I wasn't sure we were going to be able to even pull this off because of the internet. That's some sort of issue going on tonight. So we are running off my phone's internet. So hold strong, little Verizon phone. So we're going to have to just plow through this. So here's the deal. I put out a video earlier tonight. We're going to watch that video together. And then I'm going to take questions from you all because I know that you probably have them. There's all the conversation that's going on around compounds right now. I had sort of this idea that people should probably be thinking forward a little bit in a certain way. And so I want to play the video. We can watch together. And then if you all have questions, drop them in the comments. We'll go over those questions, and then we're going to jump right to Corey, right to Allie, and then we'll bring in Dr. Toomer. So let's watch this together. And give me your thoughts and questions. Are you hoping to stay on a compound despite what is happening in the lawsuit over semaglutide and tirzepatide? I'm going to give you the most practical advice that I can give you based upon where I think this might all be headed. For those of you who don't know me, my name is Dave. I have a website called On the Pen, and we've covered all of this stuff as closely as anyone on the planet has for the last 2 years. I also made a video about this earlier that I think was a little unclear for people, so I want to be very clear in the wording that I use. Your telehealth company has likely told you that they will continue to offer compounded versions of tirzepatide and semaglutide even after this lawsuit is resolved, whatever the outcome is. And now that we know that the preliminary injunction was denied, we know that the enforcement will start on the copies of the branded medications that are being offered by compounds now, and they're all going to have to move to custom doses and custom formulations, meaning doses that are not commercially available or formulations that add something to the active ingredient to make it different than what is commercially available. But here's what I think is going to end up happening. I think that Eli Lilly and Novo Nordisk and maybe even the FDA will be actually going after and actively seeking out doctors who were writing compounds that were exact copies of the branded medications, who are now switching all of their patients to the custom formulations, because the spirit of the code for 503A pharmacies that are always able to make patented medications if a patient requires something that differs from what is commercially available. I think those doctors are going to have a hard time proving that their patients who were on copies of the branded medication all of a sudden have a medical need for a non-commercially available dose or a custom formulation to help circumvent side effects. Those doctors are going to have to make that medical case. So here's what I'm saying to you. If you want to stay on compounds, it is imperative that your doctor has documented the fact that you do not tolerate the commercially available doses, or that your side effects are so bad that you do not tolerate the formulation of the branded versions. Only then will patients be allowed to use the custom doses and custom formulations. So the time to get that documented in your medical record is now, not after there's a huge clampdown on doctors who are suddenly switching all of their patients who are on copies of the branded medication to these custom formulations. I hope I have said that clear enough here. And I hope that you all are understanding that what is ending for 503B pharmacies and 503A pharmacies is the compounding that allows for exact copies of what is made commercially. And everything from March 19th on for tirzepatide, and soon to follow will be semaglutide, will only be compounds that are available in doses that differ from what is commercially available, or they're the same dose, but the formulation adds an ingredient to help a patient tolerate a side effect like nausea or fatigue or muscle wasting. Custom formulations may be the future for these telehealth companies, but the point that I'm trying to make in this video is that there is a medical need that a patient has to have documented in order to qualify for a custom dose or custom formulation. And I believe that there will be some major crackdowns on doctors who are seen as switching all of their patients on copies over to these custom formulations to circumvent the law. Okay, so here's what I want to build on that, because I made that video for TikTok originally, and there's not a lot of room for nuance in the discussion on TikTok. I'm surprised that I did a 4-minute video, to be honest with you. So there's some stuff I want to wrap around that. So the first thing is, many people will immediately say, well, it's a HIPAA violation for them to get into your medical records. How are they ever going to know the doctors are prescribing this? It's sort of whatever. Let me just give you a refresher of the links that these companies are willing to go to defend their patents. So let's just take a look at this article here. This article is back from, September 20th of this year, where we learned that Lilly was requesting patient health records. So in a startling and shocking move, Eli Lilly sent out a letter to a patient informing them that Lilly had recently learned that you took one of our products from a compounded pharmacy. The language there, by the way, still gets me. Like, is it a copy of the medicine or is it not? Because all of the court filings are arguing that they're not the same. But then you actually see a document that came out from Eli Lilly says that you took one of our products from a compounded pharmacy. So essentially, I actually reached out to Eli Lilly on this one and got a quote from them. Patient safety is Lilly's top priority, and we actively engage in monitoring, evaluating, and reporting safety information for all of our medicines. At times, Lilly may contact individuals who have previously contacted the company so we can gain more information. This represents one of those cases. Just looking out for you. I added that last part. Okay, so I just want to bring that up just to bring context to the fact that they will find a way. They'll find a way to know that this is happening. And the reality is that when you look at how telehealths are run, many of them are run on the back end by the same conglomerate of prescribers, medical doctors, RNs, what are they? Not RNs. Oh gosh, I'm drawing a blank. Y'all can help me out in the comments, but nurse practitioners is the word I'm looking for. But anyway, the point is, it's not going to be very hard for them, and they have legions of lawyers, right? And that's sort of the thing is what is the future going to be when we see doctors, prescribers receiving cease and desist letters? It happened back in the fall. And so to think that it won't happen again is wild. And then people are bringing up the point in the comments too, and this is a completely valid point. When you sign up for the savings card on the Lilly website, you are actually signing a waiver that gives them permission to access your medical records. Or sorry, it's a HIPAA waiver is probably the more accurate way to say it. It's a HIPAA waiver. And so my point isn't to paint Eli Lilly as this big evil company by any stretch of the imagination. They developed the drug that we're all clamoring for, and we thank them for it. But my point is to say these companies will vigorously defend their patents, and they have legions of lawyers to do it. And we're talking about two of the largest companies in the world, not just two of the largest drug manufacturers. We're talking about two of the largest companies in the world. They're going to vigorously defend these patents. And so my purpose in making that video was just to let you know, if you have struggled during the titration process and the custom or the current doses that are commercially available are too much for you when you go to titrate up, it's time to talk to your doctor and make sure that that's documented, right? Because when ultimately, and I'm speaking especially to telehealth companies, when these telehealth companies start to play the legal back and forth once this shortage is completely over, the March 19th deadline passes, it's going to be a lot of pivoting. And you may see that people who were on the compounds that were exact copies and tolerated the doses as they titrated up 2.55, 7.5, 10, 12.5, 15, and all of a sudden they're requiring custom doses, it's going to raise a red flag. And really, honestly, it's not so much that Lilly can get into your medical records or that the FDA is going to be combing through these prescriptions. The bigger issue is that these companies, these telehealth companies are always going to be in a constant state of evaluating their liability and their exposure, right? And their policy and procedures and what they offer to patients is often going to be dictated by their appetite for that legal exposure. I see some of my legal friends like Mike in the comments. Y'all know do you smell what I'm stepping in? That's what we say in Iowa. Y'all smell what I'm stepping in? When push comes to shove, we just want to make sure that your medical record is appropriately noted. If I'm not saying to make stuff up, I'm just saying make sure it's appropriately noted if you have struggled with the titration, or if you've struggled with nausea to the point where you feel like you need to discontinue the medication or adjust your dosing or not go up as high as you need to. Like, all of these things are things that should be documented. That's the whole point. It was a thought that I had today. I was like, you know what? I could see this kind of going this way. And I just think it's important that we talk to our doctors about making sure that the struggles that we've had are documented in appropriate way, so that you can have your best shot at staying on the 503A versions of the compounds that these telehealth companies are so confident are just going to continue on, and patients aren't even going to feel a hiccup. I just don't agree with that. I think it's going to be bumpy at best. And I just think we got to do what we can do to be prepared. So I didn't see any questions in the comments. I do see one that said, that doesn't look like a question though. If anyone has a comment, you can drop, or a question, you can drop it in the chat. Otherwise, we're going to keep plowing through here, and we are going to move to one of our favorite times of the week. And that would be our maintenance minute with our friend, Corey.
I'm Corey. We often think of weight maintenance as a number on the scale, but we all know that number can shift based on things as simple as how much water we drank or whether we had sushi or pizza that last night. So instead of tying success to a specific number, I like to think of maintenance as a feeling. How well your body functions, how much energy you have, and how strong and capable you feel each day. For those of us using GLP-1 medications, maintenance comes with its own learning curve. These medications help regulate appetite and metabolism, which is great, until you sit down for a meal, take 3 bites, and suddenly feel full while the rest of your plate looks back at you like, what now? Finding balance means making sure we're still getting enough nourishment, even when hunger cues are subtle. Because let's be honest, nobody should be running on fumes and calling it success. Maintenance isn't about eating as little as possible. It's about fueling our bodies so they can stay strong, energetic, and resilient. Movement plays a big role too, not as a way to earn food, but as a way to keep ourselves strong and mobile. The goal isn't to spend hours in the gym. It's to maintain muscle, support bone health, and move in ways that feel good so we can continue doing the things we love. Whether that's lifting grocery bags without a second thought, running around with kids or grandkids, or just feeling steady and confident in our own bodies, movement is about what we gain, not what we burn. And while weight is one measure of progress, it's not the most important one. Our lab results, our ability to sleep well, our strength, our confidence, those tell us far more about how well we're maintaining our health. A great lab report is basically the adult version of getting a gold star. And I think we can all agree it feels pretty good to know we're taking care of ourselves in a way that's sustainable. True maintenance isn't about staying at some goal weight forever. It's about building a lifestyle that supports long-term health, strength, and peace of mind. It's about feeling comfortable in your own skin, trusting yourself around food, and knowing you're taking care of your body in a way that doesn't feel like a constant battle. The real goal isn't just to maintain weight. It's to maintain a life that feels good to live. And that is your Maintenance Minute.
Corey always brings such a good word to the community each week. I love what Mike just said. Corey is the light at the end of the tunnel. Absolutely. I love that. My favorite line from Corey this week is no one should be running on fumes and calling it success. I love that line. And how many of us can identify with, exerting yourself to that degree for month after month after month, trying to reach a goal until you just fizzle out. And that's where the upswing of the roller coaster comes back in, right? So just such a good word and a good perspective on maintenance each and every week from our friend Corey. You can follow her at Corey.take2 on TikTok. And I hope that you do. I kind of skipped over our housekeeping announcements, but I want to tell you that this Friday night, we will have our friend, I'm trying to go with there we go. We have our friend Sabrina hosting our Friday Night Live panel, where we will be discussing all things GLP-1 journey. It's such a great time each and every week. It's a huge panel too. Sabrina, I don't know how many people, I know she's in the comments tonight. Give her some love if you've been enjoying these Friday Night Live panels at 7 p.m. Central every other week. This is our week to have one. But it's just such a great time hearing from many people in the community, many perspectives, many backgrounds, many stories. And I just love that Sabrina has brought that over to OTP. And you can catch that this week. And if you would like to be part of the live panel, right? Some of us want to tell our story, but some of us don't want to have a whole YouTube channel about it. We just want to have our story heard. Like so much, everybody wants to have their story heard in one way or another. Not everybody feels comfortable behind camera, but if you want to join this panel, you can send a message to onthepen.com/Sabrina, where we have a nice little thing that you can fill out if you'd like to be a part of that. So that's this Friday. Wanted to make sure that I gave you all a reminder that that's going on this week. And with that said, another little housekeeping thing we got to make sure we mention every week, that we're thankful for our sponsors. Row is the sponsor of our podcast and our Thursday night show. They are the reason this happens. Row has a program called Row Body, which will connect you with a doctor who, where appropriate, can prescribe these medications, including the vials from Lilly, the Zepbound vials. You can get them directly through the Row platform. There was some news today that some other telehealths are providing them, but Row remains the only one where you don't even have to leave their app to pay for it, to get it. It's a seamless integration with the Row app if you want to get the Zepbound vials through Lilly direct. So definitely check out row.co/OTP and learn more about the Row Body program, as well as learn a little bit more about these medications. Of course, if you're going to start any new medication, you want to make sure that you familiarize yourself with the fact that these are not just magic pills, magic shots. They do come with side effects like any drug that you should inform yourself about before you jump right into them. And you can get all that information at row.co/OTP. So thank you, Row. We love you. We appreciate you. We're going to get Z back on here soon to chat with us. It's been a while since we've had Z on. With that said, should we hear from the birthday girl this week? Should we hear from I think we should hear from the birthday girl. Give our friend Allie, Fit Flavor Fun, some love in the chat, some birthday love as we watch this week's Reddit recap.
It's Allie, and I wanted to do something a little bit different for the Reddit recap today, because today is my birthday and I'll party if I want to. So we're going to go rogue. We're going to do something a little bit different, but I wanted to talk to you about celebrations, because I noticed that everyone was asking me the same question about my birthday, which, if I haven't mentioned, is today. So everybody wanted to know, where are you going to eat? What are you going to do? What are you going to eat? A cake? Are you going to eat a cupcake? Where are you going to eat for your birthday? What are you going to do for dinner? This was the almost entirety of the conversation around my birthday. And it brought a lot of things to the forefront, and I wanted to talk to you about celebrations and breaking these traditions, because we have this long-standing tradition of big events in our lives being based around food. And I want to encourage you to change that dynamic in your life. So if someone asks you, oh, you got a promotion, great, let's go out to eat, right? Everything doesn't have to be centered around food. And for me specifically, this is one of the many, many aspects that has helped me in my relationship with food. Taking away that kind of overexcitement that comes with, going out for a special occasion. And then, everybody's saying, oh, are you going to have a cake? Are you going to do this? Are you going to do that? What does that have to do with the day of your birth? It's something that we've always done. It's tradition, right? Even little 1-year-old kiddos are, getting their hands dug into the cake, right? We've been doing it as long as we can remember. But what if you had a celebration of the day of your birthing that did not revolve around food? It did not revolve around a cake. What would you do then? Where would you go? How would you spend your time with family, with friends, with significant others? What would you do? So I encourage you down in the comments section below, let me know what you're planning to do for your birthday that's not food related or centered around food. And this is Allie signing off on your Reddit recap, which was really more of a birthday recap, but You get what I was going for.
We got you, boo. Happy birthday, Allie. Happy birthday. And what an excellent point. I don't know. Is this a cultural thing? Is it a family thing? Everything revolves around food. It's like everything revolves around food. You know, somebody dies, people bring you food. It's your birthday, people want to take you out for food. It's like every event is a reason for food. And I think it's because it's woven into how many of us feel comfort. We feel comfort from food. We feel nostalgia from food. We feel all sorts of emotions wrapped up in food. And I honestly can't imagine a world where food didn't bring some sort of emotion. And I think that that's like something when we talk about the head work that has to be done in living with the disease of obesity and overcoming the disease of obesity, that is such a huge part of it. And something that is often discussed on the Friday Night Live panel. So if you are looking at, dealing with the head stuff a little bit more seriously, I couldn't encourage you more to jump over and check out Sabrina's live panel on Friday nights. So I hope that you'll join us. Thank you, Allie, for that wonderful update. And thank you for just bringing that recap every single month. I really, or every single month, every single Friday or Thursday. What day is this even? I'm getting texts from my wife right now about my sick children, so I'm a wee bit distracted. So yeah, thank you for bringing this every Thursday to us. I really, really appreciate it. Now, let's jump in and let's welcome in tonight's we call it the hot channel, Dr. Toomer. It's the hot channel. And Dr. Toomer does have a YouTube channel on, and I believe we're streaming to her channel tonight too. So let's welcome in tonight's hot channel, Dr. Catherine Toomer.
Hot channel.
Dr. Toomer, welcome.
Thank you.
How are you tonight?
I'm fine. I just wasn't expecting that.
I don't think most of the guests are. No, I told you we have a lot of fun around here. So thank you for being here. It's so lovely to meet you, and I am excited to introduce you to the On the Pen community. What have you thought of the show so far?
It's great. It is really great.
Yeah, we have a good time, and there's just such good information. I think my favorite part is the fact that Corey and Allie contribute something to people who are just at different stages of their journey every week. And one of the things that I've been struggling through this journey for a long, long time, and even with the medicines, I'm kind of a slower responder. And so one of the things that we've really tried to do is put something in, reach that point, or are reaching that point, and are thinking in those terms. And so I just appreciate what they bring every week. Now, I am interested in hearing a little bit more about you, Dr. Toomer. So tell me a little bit, how did you pick this sort of health vertical to help people living with the disease of obesity? Like, what was your calling sort of getting into this?
My calling. Okay. Well, do you mind if I just say thank you to the people who are sending me comments?
By all means.
I actually came to this to save my life. To put it very straightforwardly. About 25 years ago, I had a health crisis. And I went in congestive heart failure after my daughter was born. My diagnosis was delayed by about 2 weeks, which almost killed me because they assigned all of my symptoms to my obesity. And so I was having shortness of breath. I was tired. I could barely move. And they kept saying, well, you're deconditioned. What did you expect? And And they kept going on. Well, 2 weeks later, I was in the hospital with my ejection fraction being 15%, which is essentially about one fourth of what we want it to be. But I knew that if I didn't take charge of my metabolic health, because I was also an insulin-dependent diabetic, because I knew no one would help me lose weight and no one would touch me because of my heart. So I figured I have to do it on my own. So I ended up creating my own program. And that's how I ended up using my own metabolic health, my own information, applying it to later to patients. And then when GLP-1s came out, I was actually put on one to protect my heart, to preserve my ejection fraction. My weight dropped even more. I had already lost some by white knuckling it, but all of a sudden it got so much easier. And then I started using it with my patients, and I used it with my diabetic patients. This started about 15 years ago. And then realized my diabetic patients were having resulting in or having weight loss as a result of using Victoza then. And so I started using it with all of my metabolic patients, those with polycystic ovary syndrome, diabetes, prediabetes, anyone that needed help to control their metabolic process. And mind you, this was before Saxenda came out. And I got a lot of resistance from a lot of my colleagues, but I knew it worked, and I kept using it. And then
you knew it worked because it worked for you, right?
It worked for me, and because it was working for my diabetic patients as well. I was one of the few non-endocrinologists using GLP-1 to treat my diabetics.
Yeah, because way back when Victoza came out, even before Saxenda, you're talking about the only thing that you had before then was exenatide, right? Byetta.
We had Byetta and Bydureon.
Yeah. And so this was not widely talked about, widely understood, or widely studied for anything beyond glycemic control, right? I mean, eventually you got Victoza, which was the obesity management version of liraglutide. But to be, you were kind of a forerunner. It's very interesting because we had Dr. Simi Lee on a couple of weeks ago, cardiologist out of Boston area. And she was talking about this as well. An early prescriber of GLP-1s for heart issues and other metabolic things. And so one of the things I want to just kind of grab onto here is this is an outside perspective, and it's certainly not to be a knock against medical doctors. It's an observation. I think that oftentimes many in the medical community are so locked in to the studies, like what's going on in the studies.
Absolutely.
And in the reality of what patients are saying sort of gets lost in the numbers and the charts and the graphs. And so I definitely applaud doctors who are willing to observe and sort of rationalize what they see and what they're hearing, maybe in their own life or with their own patients in their own practice, and sort of compare and contrast that with the data, and then be willing to sort of be a forerunner. Because if it weren't for doctors observing this, reporting this, prescribing it for this stuff, do we ever get the select trials in Ozempic or in semaglutide, right? Which now we have an indication where people on Medicare are able to get Wegovy because you can get it for heart failure now.
Yes.
So I applaud people like you and Dr. Lee who are forerunners and able to, see their patients too and see what other benefits may be extracted from these medicines. So tell us a little bit more about your own story, because I'm interested. So you found Victoza. Victoza was
Saxenda wasn't even out yet.
Saxenda was later on. Tell me what kind of success did you get to like a goal weight with that, or a goal, let's say like a goal health?
I never had weight loss as a goal. So essentially what happened is my goal was to get off insulin. And so I worked really hard to get my diabetes under control. By doing that, I essentially was on a ketogenic diet, not knowing that's what it was because we didn't have a name for it then. And so I just went on a high protein, low carb diet, and my weight started coming down. as a result of controlling my diabetes. So my goal was to get off insulin. So as that focus, my weight kind of came along with it. But that also I had a light bulb moment. It's like your metabolic health and your size go together. Because I knew that also, and then I did start thinking in terms of my size, and that I knew my heart would do less work if I were smaller. And
It's less
so
blood to pump around.
exactly, just less, work to do. And and so I tried not to make it too much of a focus, because I'd never been someone who cared much about my weight, which is actually probably how I ended up 100 pounds heavier than, because I didn't really obsess about my weight at all. And so as I started gaining weight from stress from med school and from undergraduate and getting married, having 3 children in 2 years, I didn't really notice.
Say that
And
again.
no one around me said
Wait
anything.
a minute. I can't get past that. You did what? You had 3 children in 2 years?
No, sorry, 2 children in 3 years.
Oh, okay. It's like,
The other way
wow.
around. Yeah, not my
Yeah.
numbers and stuff. But yeah, and I was in my, mid to late 30s, so it wasn't like, I was going to bounce back from that. And
Yeah.
so, and honestly, if I hadn't gone into congestive heart failure, I probably wouldn't have taken as good care of my health. But
Isn't it funny how like sometimes we need those pushes, like they can be a blessing in disguise in a way, right?
Yeah. And
Hard to
it
call
was.
heart failure like a blessing, but
Well, it is. It makes me appreciate life so much more.
sure.
And I'll be turning 60 this year. I did not expect to live 5 years. I was told I probably would not live.
Oh, wow.
And so, and most women who have what I had, especially with the numbers that I had, do not survive it. There's a 50% mortality rate.
Was there a heart attack involved, or
No,
was
it's what happened. My heart just went floppy. It
Wow.
it became 3 times its normal size. It could not.
related to the stress of birth, or did they, or just
Don't know.
congenital,
Really
or
don't know.
wow.
It is more common in people of African descent. It is
Okay.
more common in people who have sickle cell trait. It's more common in anyone with any type of anemia. And they think there may be some familial connection, but
Sure.
it's not very common, but it is very fatal. And
I
usually with those people who survive, half of those women need heart transplants.
Oh my goodness.
Yeah.
So let's just camp out on that for a moment, if you will. Um, what you're at this point a young mom, right?
Mhm.
What kind of things go through your head when the doctor says you got, your heart's going floppy on you?
Yeah.
You got 5 years. Like what
Yeah.
does that
Well,
do to
sadly,
you
I
emotionally?
actually knew my very first patient as a resident in my training that I lost was a 17-year-old with the exact same diagnosis.
Oh my gosh.
And so I knew,
How serious
I
it was.
knew what my prognosis was.
Yeah, you're looking at it, you're going, that's a 17-year-old body, and here
Mhm.
you are a bit later along in
I was
life, and
36, 38,
yeah,
37.
so twice
Yeah.
the age,
And
yeah.
and it was really it was scary. It was scary for all of us.
I can
And
imagine. Ah,
but what helped my health, getting my health together, gave me something to focus on. But also something that I did. Now, this is, you mentioned earlier about, listening to patients and paying attention. I
yeah.
have to say that my med school education and my residency training always taught me treat the person, not their numbers,
Oh, I love that.
always. And so I just applied the same to myself. Treat
Mhm,
me first, not my numbers. And so I realized I was in severe depression, had
mhm,
postpartum depression, cardiac disease causes depression.
right.
And so that's what I actually treated my depression first before anything else, because otherwise I had no motivation to do
Mm,
anything, because that's
yeah.
what depression does. It saps your motivation. And so I took antidepressants. I just put myself on one because I couldn't
Mm.
get any doctor to do it, so I did it to myself.
You
For
gotta do
myself.
what you gotta do, right?
And it so happened that my favorite antidepressant was bupropion, not even, and then we didn't have Contrave. So
Right.
we didn't know that it was, and it just so happened that was the one I chose.
Yeah. So help. That probably went over a lot of people's heads in the chat. Can you talk about the significance of what bupropion is and how it's used now?
Okay.
Because there's a lot of people who probably even in the coming weeks will be treated by physicians who were previously prescribing compounds. They don't want to anymore. Let's move to a branded. GLPs aren't covered. Let's talk a little bit about Contrave.
Okay. So what Contrave is, it's a dual medication of bupropion and naltrexone. So what bupropion is a what's called an SSNI, which is a type of antidepressant. And essentially what it does is it helps suppress appetite. It's one of the few antidepressants that does not cause weight gain. In fact, it does the opposite. And it works rather quickly. It has very few side effects usually. The only contraindication is someone has seizures in the past. You can't use it. And then it has 3 different types. You have your immediate response, your kind of what's called SR, sustainable, and then you have the XL, which is the long acting. And the naltrexone actually was more widely used for headaches, and it just suppressed appetite also. When they combined the two together, it actually really suppressed appetite, but without a lot of the side effects that we saw with and of course I'm blanking on the name, on Adipex, basically, because it doesn't have the same cardiac reaction,
Right.
but it does give you really, really dry mouth. So actually, as a doctor, I tend to separate them and only use the bupropion. I rarely use the naltrexone because it does have that. Usually the side effects come from that.
Okay. Interesting. And people respond fairly well to it.
Yeah, they do. And it's a quick response. So we always know if it's going to work or not.
Oh, great.
Quickly.
And I would imagine that bupropion is, if you're just prescribing it by itself as like a monotherapy off label for weight management, I imagine it's very cheap.
It is.
You know,
It's
like
only
a couple
few
dollars.
dollars.
Yeah.
Yeah.
That's great. So Patricia asks, is it something like Wellbutrin?
It's exactly the same. Wellbutrin is one of the brand names for bupropion. So we have it. It's Wellbutrin for depression. It is used for smoking cessation as well. And some reason I'm blanking on name.
Chantix?
Yeah, named is it Chantix? It might be. It's been so long since I've prescribed for anything other than for weight loss. And then those are the 2 most common uses. And there's one other. And for some reason, I'm just blanking on meds today. It's kind of late.
We're going back.
It's my bedtime, and we both had that kind of a day today.
Yeah, we did.
I'm still on island time. Yeah, but it has there's 3 different brands, 3 things that it's used for, and depending on what it's used for, kind of like for Ozempic versus Wegovy, depending on what it's used for.
Right. The different indications for yeah. Well, so all that to say, and there are a couple other weight management drugs out there that your doctors may be looking at, and just so people are aware, Contrave is one of them. There's another dual therapy. It's topiramate and phentermine. I can't remember what that is, what the brand is called of that one, but
starts with an L. Yeah.
So, it's all right.
Today, for some reason, today's that day I'm just kind of blanking on names of meds.
I'm right there. I'm right there with
their generics anyway.
The great thing about it is the chat will pick us up. Qsimia.
Yeah.
If we just wait long enough, they know.
Well, and also because I have always worked with in underserved areas. And so I tend to focus more on the least expensive way of getting medications. Sure. And so when it comes to brand names, I've never been all that great with them. I can tell you the generics, but when it comes
Yeah.
to the brand.
Well, hey,
Yeah.
I think that's what, when you talk about people losing access to compound,
Mhm.
more so than the reason that they exist in the first place, which is the shortages. People are there
Mhm.
because they're cheaper,
Yeah.
and they're accessible, right?
Yeah.
And so I think that's a worthy conversation. So Qsimia, Contrave, if your doctor brings either of those up, don't poo-poo them.
Mhm.
They may be a viable option for many of you. So
Yeah.
definitely you all can do your homework on Qsimia and Contrave, but not to get too far in the weeds here, Dr. Toomer, because
Okay.
that's not what we had you here for. But I
Gotcha.
appreciate you answering my questions anyway. So let's talk a little bit about so you go through residency and you're dealing with all this health stuff, and
Mhm.
you kind of come out on the other side of it, and you just sort of developed a passion out of your own journey with health to treat patients with obesity. Is that kind of a good encapsulation, or was there a little bit more to it?
And to be honest, it's not obesity. I just treated metabolic disease,
Sure. Okay.
and it just happened that obesity fell within that.
Yeah.
But in treating metabolic diseases of all kinds, whether it's menopause, polycystic ovary syndrome, prediabetes, diabetes, um, someone with obesity, it really didn't matter. They were all together in the
One and the
same
same.
group. And so by having a passion, knowing that I could do it, and knowing that I could treat people, and knowing that it would actually help save lives, which it did in a lot of different ways. You mean, people call it holistic. I call it biopsychosocial. And so I just focused on every aspect of the person that I could help them with.
Mhm.
And our brain functions on glucose. So when you control blood sugars, you control moods, you control all sorts of thinking,
Sure.
you control how you interact with the world, how the world interacts with you. And so it was life-saving on many levels. And so that's what I focused on. It just so happened over time, the most dramatic of results I got were were weight loss.
Mm.
And so it just sort of shook out that people started seeking me out for that purpose.
Sure.
And that still is the same. Although I have to say that I still am sort of known as the metabolic corrector. And so people come to me who are saying, listen, I'm gaining weight, and everyone keeps telling me I'm just vain because I want it to stop.
Mm.
And so I want, can you help me make it stop? And I'm like, yeah. I don't care. I mean, we know that if you lose 5% of your body weight, your health exponentially improves. So if you gain, regardless of what your BMI is, regardless of what your diagnoses are, if you gain it, just that increase in fat cells in your body and the hormones that it puts out and the
Right.
cytokines that it puts out, it has an adverse reaction. So I don't wait for people to fit numbers before I do something.
Yeah. Great. Great. I love that. I love that. We were reading up just 2 weeks ago, maybe on our podcast about some of the new science that's coming out about the future of obesity treatment and what they're learning in studying the different kinds of
Mhm.
fat cells and how to potentially target specifically like what's the visceral fat, right? The kind around your
Mhm.
organs, and
Yes.
that they're literally finding ways so that when you take a medication, that it's literally targeting that kind of fat. It's like an amazing to
Mhm.
think where the future is going with obesity medicine. What has it been like so you said that you're knocking on the door of 60, and so you've been practicing now
Mhm.
as a physician for 30 years,
About 25. I
25 years?
Yeah, well, I had to take a break because I couldn't practice for a long time because of
Sure.
my illness. But I would like to say I am reading the comments, and I would like to say Christy C just put a comment up there about, and she just exemplified exactly why I do what I do. So that's, if anyone, that's how I ended up here.
This one
Um
here.
yeah.
Great. Great.
Um
I love it.
Because one of the things that I did when people started losing access to their brand, I essentially provided a free way for people to get compounds. Well,
Wonderful.
free through me. I didn't charge, consultation fees or anything like that. All I did was connect them to a really
Yeah.
good pharmacy, and it helped. Um, and that's essentially what I've been doing. I just sort of like help people wherever I can and
I love
however
it.
I can. And so I do have, but the problem we started running into is it used to be the wild, wild west. You could help anybody anywhere with anything. And then all of a sudden PA started, and then shortages started. And then, insurance companies started breaking, just stop covering GLP-1s in their formularies. And so those of us who had patients who had benefited, and myself who had benefited, my family members who had benefited, we just started scrambling, trying to figure out ways that we could help maintain their success, and not just weight success. Many, many people that have been on a GLP-1 can tell you this. Your weight becomes secondary when you start noticing all the other things you're improving.
Right.
When
you get your life back.
Exactly. Your aching stops. Suddenly you're enjoying food in a way that you could before, because you're not scared to eat it, because you don't think you're going to go off the rails anymore.
Right.
So you can
There's
have taste something sweet, knowing that it's not going to send you on a binge. So it really, when you say biopsychosocial holistic, these medications really do kind of hit every aspect of who we are as humans. And trying to explain that to people, particularly with the bias and the prejudice and the attitudes that people have, not towards the medication, it's actually towards the people who are benefiting from the medication that they're superimposing on it, because it's more acceptable to say it's the medicine rather than the person.
100%.
And so
very well said.
So I get on a soapbox a lot of times.
I think I'm sensing from the chat that your soapbox is exactly what people love about you, and I love listening, because I think you're exactly right. I love how you just said that. It's oftentimes people focus their disdain at the medicine. It's the easy way out, but the disdain is focused at the person. And we talk an awful lot on the pen about there's a social currency in being thin, because for so many years, people living with obesity, there's been a moral failing sort of ascribed to that person. And so there's a moral superiority for some. I don't mean to paint with a broad brush. It's not everybody, but there are many people out there who definitely feel a moral superiority to somebody who struggles with their weight. Even tonight, my son, who is my oldest son, he's a very observant kid. And he's like, "Dad, you don't eat very much." And he's just like, it just kind of randomly brought it up at dinner time. He's like, "You don't ever eat very much." And I was like, "I know, it's very hard to live as a daddy has a disease. It's called obesity and diabetes. And there are just things in daddy's body that don't work the same way that they do in other people's bodies." And just, it's like my 11-year-old can see it. He knows his whole life his daddy has worked to control his weight and his health. And so just a very interesting observation to hear tonight.
And it's a very interesting observation for someone like me, who's been prescribing them for diabetics for 15 years and even for weight management for 15 years. Nobody cared until it became an anti-obesity medication. Then all of a sudden it's so dangerous. It's going to kill you. You don't know what it's going to do long term. And then I tell people, I've been on a GLP-1 for 12 years. So how long do you have to be on before you consider it long term?
Right. And the reality is that while GIP agonism is new, GLP-1 is not at all. And GIP is in the same umbrella as GLP-1.
It is.
And so I always like to remind people, like, these have been around for a long, long time. And the only reason they haven't been around longer for obesity management is because of bias. Right?
Absolutely.
It's built, it's baked into the system. The insurance system has always seen weight as a vanity issue and not a metabolic health issue.
Exactly.
And so there was never any money in it to develop this stuff. And now that there is, everybody's getting into the game.
Exactly. And just like you mentioned, this social currency of thinness. Currency is a good way of putting it. I mean, so I kind of equate it to people who have old money and people who have new money. People with old money don't like the people with new money, because suddenly their old money doesn't have as much value. And and so essentially it's the same thing. It's like I feel as though I matter more because of my thinness. So now that you can have it too easily, even though genetics makes it easy too. I don't know why people think that doesn't.
Excellent point.
It's like, and we see people who eat whatever they want, and they don't
Right.
gain any weight, and we say, oh, it's your genes, you have such a good genes, but they don't say it's the opposite when those of us who can smell bread and literally start gaining weight.
Oh,
That is absolutely true. It's true. I mean, people like, oh, I smell bread and I start to gain weight. You do, because your body's getting ready for that bread by jacking
yeah.
up your
You
insulin.
probably secreting insulin and everything.
Yep.
It's wild. Yeah, we always talk about too, one of the things that I like to talk about in terms of these medications is that they are leveling the metabolic playing field. They're just
Oh,
giving people a fighting chance where before they didn't. Same with bariatric surgery. I mean, bariatric surgery is sort of, I have to imagine people that have had the surgeries over the last 20 or 30 years have got to be saying, finally, there's a whole lot more people that are, ready to fight this battle that we've been fighting for years, because I remember just growing up, knowing certain people who had a bariatric surgery or whatever. And everybody was always like, they had that surgery, and now it's like, they're taking those shots.
Yeah.
And it's
And
just,
if you stop them, it's all going to come back. Well, yeah, if you stop treating any chronic disease, it's no
right.
longer controlled.
100%.
No one says that to people with hypertension taking blood pressure medications.
Right. Or, and conversely, nobody tells them, you're going to have to be on that blood pressure medicine your whole life.
Yeah. I'm like, yeah. So,
yeah, it's
but
wild.
sadly though, a lot of these comments are coming from physicians.
Yeah. It is wild. I spent, so I got the opportunity to go down to Obesity Week this year in San Antonio.
Okay.
And it was fascinating because I got to sit around the dinner table with some of the people who were involved in the very early days of the Obesity Society, and to hear the conversations that were taking place about what it took then to get the medical community on board with recognizing obesity as a disease. It gave me a whole new level of appreciation for the medical doctors who fought that fight, because that story is not widely understood by I mean, I didn't understand it before I sat at this dinner, and I was just like, my goodness. And, it's like,
and it's still being fought, because I can tell you every time GLP-1 comes up in any medical group, there's always, several people. Oh, it's not even a whole. I mean, it's about 50-50 still.
Wow.
Yeah.
And why do you think that is? Why do you think that? Because it seems so obvious to me. I mean, even if you argue that it's, it's 100% behavioral, at some point it becomes biological. Even if you want to say it's all somebody's choice whether they get fat or not. Well, once you are fat, don't you have to ignore science to say that it doesn't become a disease at some point?
Well, because obesity prejudice is acceptable, and people, and just because doctors are doctors, they still carry their biases, they still carry their prejudices with them. Not only that, but we learn from in an apprentice system. So whatever prejudices your predecessors have, they pass it on to the next generation of doctors, and it just keeps going. And maybe those coming through now may have a different understanding, I'm hoping, but there's still a lot of the old school mentality being passed on.
Yeah. Well, it feels like there's progress being made. I definitely felt a great sense of gratitude sitting at that dinner table with the physicians that were talking about the battles that they waged back in the late 80s, early 90s to really get the movement going, to get obesity recognized. And if it weren't for those trailblazers that were willing to speak up, and I think it has to be very difficult to be in the medical world. It seems like there's definitely a camaraderie, a solidarity. Like, you all went through it. Like, you went through the schooling, you paid for your school, you went through the residency programs, you did all the things, and you have to kind of go through it to understand what that's like. So I understand it to a certain extent, but then there's like, if you ever want to go against the grain, there's a definite ostracization, alienation. I don't know, maybe that's an easier word to say, but you're definitely ostracized if you say something that bucks the trend or
Yeah.
doesn't go with, the
Mhm.
common or prevailing wisdom. And I'm
Mhm.
so thankful for doctors like you, Dr. Simi Lee, and the doctors that were an integral part of getting obesity finally recognized as a disease,
Mhm.
because honestly, without those individuals, and honestly boil it down to like not that many people who really were willing to stick their feet in the sands
Mhm.
and go, hey, no, this we have to take it serious. If it's not recognized as a disease, it will never be taken seriously
Mhm.
by the pharmaceutical industry, by the insurance industry, and
Exactly.
people will continue to suffer. And
Mhm.
so I'm just so thankful that there have been trailblazers that have fought that good fight like yourself.
Appreciate it. Well, I know what it was like. Like I said, I'm 5 feet tall, and I have shed over 100 pounds.
Wow.
And when I was at my heaviest, I had colleagues say, "How in the world did you let yourself get this way?"
Oh,
I would ask for help, and I every single doctor's appointment, I sat in my car crying. Every single time. No matter what I went to the doctor for, I would end up crying because they
oh,
always I got attacked. And so, but
it's
one of the things
unbelievable.
I keep trying to explain to people is like, how in the world I could see maybe 5 pounds, 10 pounds, but how does a medication afford someone 100-pound weight loss if it's not treating something?
Correct. Correct. That's an excellent way to couch it. And I think your story is very powerful, because I think that if there's one story that seems to be like a scarlet thread through people who have lived with obesity, when they talk about the shame, because everybody who lives with obesity experiences shame, they experience guilt.
Yes.
But I think if there was one area where I think was the source of it, it's either parents or doctors,
Yeah.
right?
Or both.
And so to hear from somebody in the medical world who has experienced it from the medical world, I think is a powerful thing to hear, and just underscores the importance of continuing to fight this battle, continuing to fight for better education, better
Mhm.
understanding of of the fact that obesity is a disease and what it's like to live with it,
It is.
and then what it's like to get treatment. And I think that sort of, to put a bow on this whole thing, I think that's where this compound issue brings so much anxiety and
Mhm.
fear and worry. It's because for once in these folks' lives, they have found a treatment, as you so wonderfully put it, that has helped it's treated the disease and helped them to put it into remission, to get the 100 pounds off,
Mhm.
and then to look at a possibility of a world where they can no longer afford access to what has given them what they have,
Yeah.
is panic inducing.
It is. And even, I mean, the problem also is that the conversation, people are allowed, because it's acceptable to have prejudice against anyone with obesity. So when the conversations around weight, they're just like, "Ugh, you're so vain. You so what if you gain your weight back?" One, there's health issues involved, but
Right.
there's a lot of other, like if I were to lose access to my GLP-1, it my diabetes, I mean, my A1C went from almost 9 to now 5.3
With
with
Victoza. Wow.
Victoza.
Wow.
So even without it, it only brought my weight down a certain amount, but my A1C came down. Then I switched to Ozempic, mainly because samples were dropped off back in the days when we could get samples. And I was like, "Oh, a new one. I can only take it once a week. So let me try this one." And then I switched to Manjaro because again, samples. I was like, "Oh, let's just see what this one does." And there wasn't a big difference between Ozempic and Manjaro, but there was a huge difference between Victoza and Ozempic in
Interesting.
terms of my body's reaction to it.
Sure.
But but it's I've had so many patients tell me, "I don't care if I never lose another pound
Mm,
because I don't hurt. I can stand up without hurting. I can walk. I can travel. I don't have to worry about, where's the next bathroom because my irritable bowel syndrome, my inflammatory bowel disease has suddenly stopped.
right.
My symptoms have stopped." or migraines. I mean, there's just so many different symptoms that people are no longer living with. And but the problem is we're running into the prejudice of weight. And so everyone's focusing on weight because, I mean, we still live in a world of diet culture, and there's this blurring of the lines. And it's like, where does, healthy psychosocial, attitudes end, and where does the maladaptive behavior begin? And the problem is that these medications do allow for a lot of maladaptive behavior. But those same people were having maladaptive behavior before the medication came out. But it gives people an excuse to then sort of spout their, prejudice and bias with impunity, because no one really says anything or counters it.
Yeah. And I'm so thankful that one of the things that the advent of these powerful medications have done is that they've created an army of advocates. Every single day, there is another content creator that's popping up whose life has been changed so much so by these medications that they are devoting a good portion of their life to become what I have kind of coined as just GLP-1 evangelists, who are just spreading the word about what it's like to finally get treatment for their disease, and what it's like to finally, phrase that I use over and over on this channel, is get their life back. Because that, if I had to encapsulate everybody's story of the hundreds, if not thousands of stories that I've heard at this point, it's that people simply get their life back. And it's not about the weight loss. It's not, I mean, the weight loss is a part of it as much as the lowering of the A1C or the reduced in pain or inflammation, yada, yada, yada. The
But
bottom
it is
line
sort of like winning the lottery. I mean, you have, like you said, there is a social currency to living in a thinner body or a smaller body. And so therefore, when you do, it does somewhat feel like you just won the lottery, because suddenly the world treats you differently. Suddenly there's things that you can do that you couldn't do before, either because it was blocked because of other people's attitudes, or it was blocked because of our attitudes about ourselves, or it was blocked because we couldn't fit into the world that was created. And so, there's just so many aspects. And some of it, it's really hard being a physician in this community, in that we are villains. I mean, and rightly so. I mean, I don't like doctors, and I have one. I just understand the meanness and the dismissiveness and the the callousness that so many people encounter. And so having a voice, my voice as a patient, is much louder than my voice as the scientist or as the practitioner. But it is this community that allowed that. I didn't have a community until I joined TikTok, honestly, because I was just the prescriber. And finally, I had a community as a patient.
Wow.
And it's been not so, it's been empowering for me, but I've watched the empowerment of other people around, just learning the language, hearing the dog whistles, that lifestyle. I mean, I hear it and I'm like, I know what you're saying. You're not saying, it sounds good. How are you going to argue with someone about lifestyle? But what they're saying is, you're not doing what you're supposed to be doing. It's an accusation. It's used as a weapon. And we know this, but only in this community do people understand that.
Right. I always say that one of the things about the obesity community is, first of all, I think that it's the most underestimated community maybe out there, because the whole world equates obesity with laziness and lack of willpower.
Yeah.
And the one thing I always remind people of, I'm like, you don't have to look any further than Oprah, who has lived the most public battle with obesity that anybody on the planet has ever lived, yet she's accomplished more than anyone on the planet has ever accomplished. And so if it were simply willpower, you can't argue that somebody like Oprah lacks willpower. the woman has accomplished everything she set out to do in life.
Chefs. And so if someone who has private chefs, who has the time to exercise, is still battling with obesity, then it clearly is something else.
Right.
I mean, it's something else. It is not. And one of the things that I do a lot, and even when helping, I'm constantly helping people unlearn the self-accusations. Everyone always starts off, well, I exercise, and it's like, I didn't even ask you, but I don't want to hear about your exercise. I don't want to hear about your diet. I want to hear what happens when you get stressed. What happens when you get stressed? Where are you gaining your weight? When did it start? And then it's like, well, I gained it through the middle. It started right after I had children. We get checked for diabetes during pregnancy for a reason. Pregnancy is a metabolic disruptor. Menopause is a metabolic disruptor. Stress is a metabolic disruptor. So if you ask anyone questions along the lines of those things, you find your answer. Oh, I was told I'm pre-diabetic. I'm like, well, there's your answer. I don't know why I keep gaining weight. My doctor says I'm pre-diabetic, and all I have to do is eat less and exercise more, and it will go away. No, it won't. It might not get worse, but it's not going to go away. And so, it's just frustrating. And as you can tell, I'm very frustrated by a lot of the conversations I have. But it's sad because I do have a hard time trying to convince people it's not their fault. And when you have someone who is, building muscle, but that muscle's competing against a metabolic process, none of that workout's doing much. And then all of a sudden you start correcting for that metabolic process. And they're like, why? It's like suddenly all those push-ups, all those squats, all those planks are suddenly have an effect because your muscles are no longer fighting against this, fat versus fuel mechanism that your brain's telling you what to do, telling your body what to do with food. And but even in the face of that, I still have a hard time convincing people it's not their fault.
Well, we're hardwired. We're hardwired at this point. I mean, I'm 2 years into this medication, and I'm like relearning all the bad habits again, because it's like the medications aren't enough to get me to where I want to be health wise. And so it's like I'm just kind of turning it inward again and going, why am I why is this not working for me? Why is it not doing what it's supposed to be doing? And I mean, I don't deny that
We're
there
gonna
are
find another reason. So what we're probably going to end up doing is going to be a while, but we're going to figure out why it is that some people don't respond fully, that their metabolic process, even when it's corrected, that there's still something there, or that their metabolic process isn't fully corrected by the medication. There's probably something else underlying that we haven't discovered yet. I'm pretty sure that we're going to find that it's either some type of some type of deficiency in a vitamin deficiency, some type of molecular, biological, or biochemical issue that we just haven't identified. But I'm pretty sure, because there's absolutely no reason that it's not behavioral. I mean, you have people who are, we've all been there. We've all exercised. We've all eaten a certain way. And even on the medication, there's still stuff there.
Yeah.
I'm pretty sure there's a metabolic reason. There's a medical reason. We just haven't discovered it yet.
Yeah. As one little tidbit that I think people will find interesting, perhaps you've heard of this, maybe not. And then I'll cut you loose because I know it's getting late where you're at here. But I saw a video from Dr. Mike Albert. I don't know if you know who Dr. Mike Albert is. But he put out a video about is this idea of non-responders or slow responders even a thing? And he said that a few studies have come out now that seem to be leaning towards the idea that there aren't, and that what they're learning is that it is a lack of blood plasma concentration that varies from person to person of these medications, that they're responding, but the concentration of the medication in the blood is not equal. So
Yeah.
you may have one 300-pound guy and another 300-pound guy, and they're taking the same dose and they're taking it in the same spot, and their body is processing it differently.
Yeah, because our
And so
liver, I mean, everything is broken down and metabolized differently than the body. And a lot of it depends on proteins and what proteins you have and what other medications are interfering with those proteins. But then also, it could just be that we're measuring it by one criteria. If we're
meaning,
only measuring success of a medication by how much weight loss it affords, it could just simply be we're measuring the wrong thing.
yeah, very valid point. I think the one thing that I keep reminding myself of as a diabetic is it doesn't matter what I eat, my A1C stays normal. So in that regard, the medication is doing what it needs to be doing.
Exactly.
I'm on Mounjaro for diabetes, so it's doing what it's supposed to be doing.
Yeah.
But yeah, so it's all a tough thing to try to pin down sometimes for people.
It is. But I think that over time we'll have better delivery systems. We'll have better understanding. I think that the scientific curiosity is going to catch up to the reality of what these medications do. Right now, people just aren't curious enough. And so the only thing that's driving this is money.
Yeah.
When
And
science
weight loss is so big that it's just a money tree.
Yeah.
You know, it's the gift that keeps on giving. What does it have? Does the money have to slow down to increase the curiosity?
Well, the problem is that everybody's making money off it. So you have people who really have no clue of what they're doing, who are still making money off of essentially. They're going after people's insecurities. They're poking their insecurities and basically making money off of it.
Yeah.
And as long as that happens, as long as there's a lot of money to be made, it's a multi-billion-dollar industry for a reason.
What changes that? That's not going to change.
No, it's not. So the only thing that can change is if we improve the delivery or we improve what we have to use. So that regardless of the results, regardless of the money people are making, at least we're getting healthy from it, which is essentially what's helping now. But as long as it's being monitored, as long as it's being, used properly and not abused, then it's probably one of the healthiest medications out there.
Yeah. I know the world doesn't want to hear that, but
No,
but I'm hard pressed.
And this is the other thing, and I just want to make this point.
Yeah, please.
And this is something that everyone needs to be aware of. With the advent of the internet and the closing down of actually print, newspapers and magazines and everything else, writers make their money based on clicks. And so the most sensational headlines get more clicks. No one wants to hear about a safe medication. No one wants to hear about how it helps. What they do want to hear is who died because of it, who had, stomach paralysis. The thing is, the medications are used for diabetics. Every single complication you read about is a complication of diabetes. Way before the medications came out.
I know. I love the pancreatitis one, especially. Like, enjoy your pancreatitis.
Does not cause pancreatitis. However, rapid weight loss does cause gallstones, which then cause pancreatitis. But the problem is that doctors hear pancreatitis and they immediately remove the medication. They won't put you back on it, when in fact it wasn't the medication that did it.
It was the weight loss.
But all you have to do is slow down the weight loss, and then you're fine. Or if the gallbladder's out, then that's it. You can't get gallstones anymore. So, but there's this. The other is, we are in a litigious society, and so you have a lot of doctors who just practice based on not wanting to be
being safe. That kind of goes back to what I was talking about compounds. That is where these telehealths are going to go, right? So when everybody and then we can kind of wrap it up for the night. And I love it.
I know.
I'd love it if we could do this
keep
again.
giving me my soapbox.
I love it. I love it. I frankly, I just love to hear you talk. So I would love to do this again.
But no, it's we're improving. It's not as bad. I mean, I watched this whole thing play out, and even everyone's like TikTok, TikTok, TikTok. TikTok has been the saving grace of this medication. TikTok has been my saving grace. I mean, really, I avoided TikTok for the longest time because we were told as doctors we should not be on there. I'm not risk adverse. I mean, if I could practice without malpractice insurance, I would, you know, but you can't. So I just, I figure, what's the worst thing that can happen?
I love
You
it.
know?
I love it. Thank you, Dr. Toomer. Where obviously you have a YouTube channel. We're
Mhm.
streaming on, for your point of reference, we're streaming on Facebook, LinkedIn, YouTube,
Mhm.
Twitter. So where can people find you? What's your handle?
All right. Well, I'm Dr. Toomer almost everywhere except TikTok, because there was already a Dr. Toomer, so I'm Dr. Toomer Talks on TikTok. Just don't say that fast 10 times. And then every Tuesday at 6 p.m. Eastern, I have my own YouTube Dr. Toomer Talks show that I stream on YouTube, Facebook, LinkedIn as well.
Wonderful. On Tuesday
And,
nights, you said.
but I have everything on my website, which is drtoomer.com. So,
drtoomer.com. Easy enough. And
yeah,
you have, do you have an online practice that people can look
I
up?
do. I have a telemedicine practice. I have telemedicine practice where I have my own private patients. I have a platform where I actually teaching doctors to
Great.
treat people well and how to treat them, not just, scientifically well, but also psychosocially well. And then I just formed a national telehealth um, group to help people, because so many people are losing access. So we have most states covered. It's like 43 doctors, and I think we're at 47 states right now, including, and so, and
You're
all
getting
of
after
that
it.
is,
That's a lot of work to get 47 states covered.
it is. Well, and
Lot
you
of
know,
hoops
it
to jump.
wasn't a lot, and mainly
Really?
because I set my reputation. And so when I put out the call to doctors, I got them.
Great.
Yeah.
Amazing. Good for you.
Yeah,
That's
so it's on.
amazing. 47 states.
There's a link for every single thing that I do on my website under contacts. So if you just need if you need to get connected to a doctor in your state, there's a form. If you want to connect with me, there's a form. If you want to, get your doctor to learn something, there's a form.
Go-
I actually
go-
have patients. I
go to
actually have
school.
people who's like, I made my doctor watch one of your YouTube videos.
That's amazing.
I'm like, they're gonna hate me.
She
But,
said that doctors like you could learn a thing or two from her. I love it.
yeah,
I love it.
doctors like that.
Well, Dr. Toomer, it was a delight to have you here On the Pen tonight.
Thank
I'm
you.
so grateful that you were willing to spend some time with us
Absolutely.
tonight and share your wisdom. I hope that we can do it again.
Of course,
Dr.
anytime.
Toomer, everywhere. You can find her at Dr. Toomer, or if you're on TikTok, at Dr. Toomer Talks on TikTok. So please make sure you give her a follow. And thank you again for being here tonight. I very much appreciate your time.
Oh, thank you.
Take care.
Okay.
Dr. Toomer, I hope you enjoyed that as much as I did. What a wonderful conversation that was tonight. And we covered a lot of things. I said, I don't know where we're going to go with the conversation tonight. I don't really have a vision for it, but I know once we get going, we won't be stopped. And that was definitely the case. So hopefully we can get Dr. Toomer back and do this again. If you enjoyed it, let me know in the comments of this video and give her some love over on her social medias. Make sure that you give her a follow. Just a couple of things, housekeeping things that I wanted to glance over tonight. We gave a couple of books away on the last show. So I want to say, if you caught the set here, we've got a lot of books now. I ordered hundreds from Amazon in case it ever goes away again. So because I have hundreds of books now, I'd like to just give a couple away on every stream. So again, the book, if you're new to the channel, is all about having better conversations with a loved one in your life. Everybody on this platform, very early on, I identified there was a need to give people a tool that allowed them to have an open, honest conversation with their loved ones about being on the pen. Because I could not believe how many people were scared to talk to their mom, scared to talk to their dad or their aunt or their spouse about the fact that they were looking into treatment for their metabolic disease. That is exactly why I wrote this quick guide. And literally it just is, it's my, as a creator in the anti-obesity space, it's my life's work. I mean, I put this together over this past summer to try to be a very easily digestible thing that you could pass off to a loved one, that they could read in an hour and a half, depending on how quick they read. By the time they get done with it, they're going to know a little bit more about what it's like to live with the disease of diabetes or obesity. They're going to know a little bit about the history of these medications. It's going to debunk a lot of things that they hear in the media, and it's going to make them have a lot better understanding of why you chose to do what you do. And all you have to do is pass it off to them. Right. So I want to give, if that's you tonight and you could use this, just put your name in the comments of this video with the book emoji and say, I could use this with the book emoji. I'll give 2 of them away randomly. And we'll do this every week at On the Pen. You just have to remind me. And then if you win, all you have to do is just email. You can just go to glpbook.com. glpbook.com will take you right to the Amazon listing. If you want to buy a copy, $7.99 for the digital copy. It's $12.99 for the paperback, and help keep us on top of that of the Amazon charts. Because even if you just go by there, pick up a book, if you've been waiting, we just need a few a day. It really helps us to stay on top of the Amazon list there in the diabetes category, which is huge because number 1 is Dr. Jason Fung's the diabetes code. In many days we're number 2, or we even kind of go to number 1. So all I need is your help with that. So yes, thank you for being here. Thank you for being the best part of what we do on this channel. Honeybees wants to know, are you canceling reading your book for free? No, the first 4 chapters, and there are only 10. The first 4 chapters are in a playlist. I'm reading it out loud. I'm just doing it as I have time, though. I will continue to do that, and I'll continue to add it till all of the chapters are there. So yeah, if you just want to point people to the playlist, I've got 4 chapters up on the playlist on YouTube here, and I promise you, we will get to the rest of the book too. It's time, people. This isn't my full-time gig. I have a full-time job. I have 4 kids, 3 of which have influenza A, including my wife. So that said, that's where I need to be now. But yes, and if you want to purchase it directly and you want like a signed copy, sorry, I'm responding to what people are saying in the comments. I didn't intend for this to be a 10-minute thing. But if you go to onthepen.com and to the menu, there's OTP book. If you just click that, there's an option to buy a copy that I will sign and write a personal inscription encouragement in there for you. Directions are there. So yeah, just go to onthepen.com, or if you want to get it off Amazon, glpbook.com. So yeah, that's enough. That's enough for this week. We're going to have a great panel tomorrow night, Friday night, Sabrina's live panel, 7 p.m. on this channel. Make sure you hit the subscribe button, hit the bell. That'll notify you to remind you that Sabrina's thing is live tomorrow. And every time we go live, we've got a great video coming up on orforglipron. I've been putting it together over the last couple of days. I'm actually editing a video for once. Can you believe it? Putting it together. It's going to be everything you need to know about orforglipron. And so that'll be coming up this next week. And of course, we'll be back here next week. 9 p.m. Central. Thank you for being here. Thank you for being the best part of what we do here on the Pen. I could not, should not, and would not do this thing without you. It takes all of us doing this together. So thank you for being here. Now, for this week, may the Lord bless you and keep you, cause his face to shine upon each and every one of you within the sound of my voice. And may he be so gracious to you this week. Friends, have a great week. Thank you for being here.